Hello, I'm Dr. Sundari Mace, Sonoma County's health officer. I'm here to share the latest updates in coronavirus in Sonoma County with you. As of today, May 20th, we have 411 confirmed cases, up 20 in the last 24 hours. 203 are active, 204 have recovered. We still have the 4 deaths that we have reported, and now we've done close to 16,000 coronavirus tests, up 1,338 in the last 24 hours. And our positivity rate is 2.5%. So today, I would like to speak to you more about testing, contact tracing, and some of the resources that are available. So first off, let's talk about testing. I would like to first distinguish testing for the virus, viral testing, which tells you if you have current infection, from antibody testing, which tells you if you have ever been infected with coronavirus. And we will be having antibody testing coming here to Sonoma County in the next couple of weeks. We'll let you know as we move forward with testing people. This is a blood test that is performed. We are going to continue to expand our efforts to perform the widespread viral testing, as this is a critical step towards reopening the county. As you know, we already have the OptumServe sites, which are funded by the state of California in Santa Rosa and Petaluma. And we have our own testing site at the Public Health Lab in Chenate Avenue, open to all high priority groups. Last weekend, we started doing some pop-up sites, which will be continuing on weekends at various sites throughout the county for the foreseeable future, targeting our highest risk populations. One of those populations is the Latinx group. This group is being disproportionately affected by COVID-19 in our community. And you can find all the information related to testing on SoCo Emergency website. It'll tell you what sites are available for testing, who they're testing, and how to contact them to get an appointment. Testing as many people as possible is important because it does increase our understanding of transmission of the virus. And when we find positives, it lets us quickly contact those who are positive to get them isolated, and then to contact the people that are their close household contacts to get them tested and have them stay in quarantine for the 14 days following their exposure to the case with COVID. In regards to testing, I want to assure the public that most of those who get tested will not need to quarantine while they await their test results. Most can go right back to work and be around their household members and continue to shelter in place as the rest of the county. Now, only those individuals that have symptoms like a fever or other flu-like symptoms, cough, shortness of breath, sore throat, are required to quarantine while they await their test results, because we're more worried that they could actually have COVID-19. Also, I want to make an important point about the contact tracing process. That is when someone tests positive for the virus, we begin tracing their close contacts. Now, when close contacts are identified, that person's name or personal information is never shared with anybody. So cases are not identified, and contacts also are not identified. Confidentiality is a matter that we take very seriously. And when this process happens, we want to ensure that your personal information won't be shared with anybody else. So we also have some resources I want to tell you about. If someone is in a situation where they have symptoms and they're awaiting their test results, or if they actually come up positive for COVID, there are county-funded accommodations where people can go to either isolate their case or to quarantine if they're in contact and they have nowhere else to stay. We have contracted with Sonoma State University, and we have the ability to place people in the student dorms, which are nice, safe, private rooms and bathrooms with access to the outdoors as well. All of this is free to the user. If you have COVID, you may also be put in the gymnasium with other persons who have COVID to wait out your isolation period. So our community question for the day is, I have a very crowded home and recently developed a cough. I don't know if I have coronavirus, but I'm wondering about the facility at Sonoma State and what it's like there. We would like all people to get tested, whether you have symptoms or not, but especially if you do have symptoms, you should get tested. If you're unable to isolate yourself from the rest of your family, but with separate sleeping quarters and bathrooms, or you live with people who are vulnerable to getting the virus, you should definitely consider the SSU accommodations. 3 meals a day are served. We now have 3 different food vendors providing food that can meet a variety of diets. We have staff there that speak Spanish. You would need to work with your doctor or the healthcare provider to get the referral to the Sonoma State University dorms. But it's a very easy process. This resource has been created for situations just like yours. You can find more information by clicking the testing button on the SoCo emergency website. So thanks for joining. I'm going to sign off now. Take care of yourselves and stay healthy.